Thank you, Senator Braun. Senator Casey.
Mr. Chairman, thanks very much for having this hearing, you and the ranking member. I wanted to direct I'll just have one question for Ms. Ward. I appreciate the testimony of everyone, and sorry we were juggling, as I'm sure Senator Braun might have shared. We're juggling hearings today with the Aging Committee and the Help Committee. But Ms. Ward, thank you so much for sharing your family's personal story. And I'm happy to hear that your sons are now thriving. And as you know, our nation has a fundamental, sacred obligation for children who need care. And unfortunately, that sacred obligation has not been met time after time. For almost 60 years, Medicaid has been our way of fulfilling that obligation. This program is a lifeline for millions of American families who use it to access care for their children, particularly in rural areas. The utilization of Medicaid and CHIP, Children's Health Insurance Program, is higher in rural areas than it is in urban areas because of the folks' incomes in those communities. I've introduced a bill to automatically enroll every child in the country, every child, in Medicaid at birth. And they'd retain that eligibility to the age of 18 without the need to re-enroll annually. The bill would guarantee coverage for over 2.6 million children in Pennsylvania. It would mean that no child will ever again be forced to grow up struggling to stay healthy due to lack of health care coverage. Medicaid includes, as everyone knows, the so-called EPSDT, early periodic screening, diagnosis, and treatment benefit. It's one of the best features of Medicaid, and we don't talk about it enough. This means that for children like yours with ongoing health needs, Medicaid would cover everything they need to identify and treat a health condition to ensure the child can thrive. So, Ms. Ward, I'd ask you, you mentioned that your family did not qualify for Medicaid and that you worked extra hours to pay for their physical, occupational, speech, and feeding therapy. Would Medicaid coverage for your twins, including the benefit of EPSDT, have helped limit your financial burden?
Thank you for the question, and thank you for your important work on this issue. My answer is yes, absolutely. It would have improved their outcomes.
And do you have any advice for us on how to make the case for the need for this legislation?
I think one way is to look at the outcomes of children who have appropriately received care and look at how their lives and their quality of life is much different than those who do not, and how their lifetime what's attained in their lifetime looks very different than children who do not receive the appropriate developmental interventions.
Well, I think the story that you've told and other families have told and have experienced is one of the ways to make the case for this legislation. Medicaid is a godsend for so many families. We've got to protect it. We've got to strengthen it. And I think we should expand it in the fashion that I just outlined, including, or I should say in addition to what we did with Medicaid expansion in 2010. Mr. Chairman, thank you, and that's all the questions I have.
Thank you very much.